The two-day stakeholders validation workshop on the situation analysis for women's health in Nigeria project is organized by Pathfinder International in Abuja to provide opportunity for key stakeholders in enforcing the main findings and provide strategic advice on the project approach and implementation and possibly recommend the development of a scorecard. Clearview's Florence Joshua brings us details.
Pathfinder International, with support from Bill and Melinda Gates Foundation, launched the Voices for Women's Health Advocacy, which is to deepen awareness and advance the health rights of women in Nigeria. The campaign included a high-level meeting that brought together representatives from the government, CSOs, development partners, members of the diplomatic community, youth, disability organizations, and various stakeholders, including the private sector, to support, promote, and intensify as they strengthen and amplify solution-oriented advocacy around women and the girl-child agency from a rights perspective.
Situational analysis of the state of women's health in Nigeria, and the goal was to develop a scorecard that would be able to use to, measure the progress that Nigeria is making, and also be able to hold, the relevant stakeholders accountable for their commitment towards improving women's health in Nigeria. That implementing partners, there are a lot of collaborations from the international body and NGOs and the likes. So we know that a lot is being done, which is why we need to be able to assess how far we've gone, and also be able to develop a scorecard to measure the progress and know who to hold responsible, to hold the government accountable, for their commitments, and be able to measure, okay, we are making progress or we're not.
For the health agenda and profiling, not just for the Nigerian woman, but for our communities. Because through every woman, healthy woman, we have a healthy community. We have healthy families. We have happier, healthier families, communities, and engagements. It's also a demonstration of resilient commitment to a cause.
Pathfinder International Country Director on Nigeria, Amina Aminu Oroyi, says, as part of effort to keep the advocacy momentum for the I Commit campaign, Pathfinder is carrying out a solution analysis and subsequently a scorecard on women's health. The situation analysis and women's health scorecard are to systematically assess various aspects of women's health with their reaching goal of promoting accountability, transparency, and improvement in policies, programs, and services related to women's health. It will be used to support advocacy for the empowerment of women in Nigeria towards establishing an accountability framework for assessing the effectiveness of gender mainstreaming.
The aim is actually to look at a broader overview of the women's health ecosystem, women's health agenda, not only one particular area of focus. And when we say women's health, it's really broad. We're looking at the different elements to say which indicators can we take that are general indicators that will say we will assess and ensure that we use this particular scorecard to actually advocate to state governments, to the federal government, to say this is where we are. Any area that we have maybe a red or a yellow means that we need to have progress, because in order for us to meet the sustainable development goals, SDGs, we need to invest in women's health. We need to invest in any action or any step that will ensure that we get closer to achieving the SDGs, which includes poverty alleviation and health and well-being, gender equality, for example.
Pathfinder International, a non-profit organization, collaborates closely with partners around the world to offer life-saving maternal, newborn, and reproductive health care, integrate health and environmental risk to address the holistic needs of communities and reach the most vulnerable populations, including those who have been displaced due to conflict and natural disaster. Florence Joshua, reporting for Clearview News Desk.